Joel Griffith, who's a research fellow at the Heritage Foundation, which is a conservative think tank. Joel, thanks for being with us. I think we focus so much on the actual job losses, those unemployment figures, that it can almost be easy to lose sight of the fact that when those jobs go, so do people's health insurance. What is this costing Americans, especially if they get sick?
You're exactly right. It's one of the problems with our healthcare system is that usually our health insurance is tied to an employer. And so if you lose your job or switch jobs, oftentimes you end up losing that health insurance. We've been talking for years about the need here at the Heritage Foundation, the need to make these health insurance policies personal and portable so that you can take those with you wherever you go. But for that to happen, we need to undo some of the damage that Obamacare has done. Obamacare has made it so difficult for states to authorize the policies that the residents need. And instead, you end up with the states really looking to meet mandates instead of making it easier for people to get the health insurance they need to pursue their dreams and to make life less difficult when people do become unemployed.
And we've seen a number of stimulus measures passed by Congress. Joel, there's talk about putting this in the next bill. How should Congress address this?
Well, there's so much that Congress needs to address this next bill. We have seen trillions of dollars of spending. We've seen a lot added to our national debt, when in reality, we see the slowdown in the economy due to the fact that governors and mayors are making it impossible for people to go to work and to go about their lives. That's the only way we are really going to get out of this recession. Over the last 2 months, we've seen 8 million jobs come back. And that's primarily not because of massive spending programs. That's because governors are finally letting their people get back to work.
This latest report, Joel, basically quantifies all of this data. And it says that all of this has amounted to the greatest health insurance losses in American history. What does that mean?
Well, that's a great question. Well, here's what we know. We know that there are approximately 5 million people that may have lost their health insurance over the last few months. But of course, that is out of a population of 330 million people. And this is a problem we need to address. It's something we should be concerned about. But also we need to keep those numbers in context. Number two, this is something that we can remedy. It's not just a simple fix that you can do with the pen of a president. This involves Congress getting involved to go ahead and roll back some of those Obamacare mandates, because those have made it very difficult for states to go ahead and allow their residents to access a broader array of health products on their own. I used to be self-employed just a few years ago when I lived in Chicago working as an independent business guy. And I was able to get a health insurance policy on my own for under $200 a month. Good luck doing that today. And a lot of that is because of the Obamacare mandates. We need to go ahead and roll those back to avoid this problem from happening again in the future.
All right, Joel Griffith, we can absolutely expect that to be a big issue of debate here during the 2020 election season here ahead of the November vote. Thanks so much for that.